watching continuing coverage of the World Healthcare Congress coming to you from Washington, D.C. I'm Mabel Jong, and in our studio right now is Scott Hines, who is Chief Quality Officer and Medical Director at Crystal Run Healthcare. And Scott helps to develop and implement the clinical programs necessary to deliver value-based care. Scott, it's so great to have you here today.
Thank you. Nice to meet you.
Well, give me a little background of Crystal Run.
Sure. Crystal Run Healthcare is a physician-owned, physician-led, multi-specialty group. We consist of about 450 providers across 35 different office locations in the lower Hudson Valley of New York State. We've been real believers in this movement towards value-based care. We're one of the first 27 accountable care organizations to participate in the Medicare Shared Savings Program dating back to 2012, and have expanded that to include multiple commercial payers, managed Medicaid plans, and also launched our own health plan in 2015.
Well, your organization certainly has witnessed a lot of change over the past few years, and change that is ongoing. Now that we are at a critical time in Washington, D.C., about future programs, are you concerned that there is a chance that Macra is going to be repealed or changed?
Sure. So unlike all of the current debate over the Affordable Care Act, I do not think that there's going to be a significant move to replace or significantly change Macra. As I'm sure you remember, Macra passed the Senate 92-8 and passed the House 292-37. You can't even get a post office renamed these days by those margins. And so I think there is broad bipartisan support for the concepts of Macra, of reorganizing Medicare to really look at paying for value, paying for quality, trying to lower the overall cost of care and show some significant improvements in the healthcare delivery system. I think both sides are in agreement on that, and so I don't think there's a significant, going to be a significant change in the way that Macra is rolled out.
Has there been anything at Crystal Run that has been adjusted to meet the uncertainties?
Sure. So, at Crystal Run Healthcare, we have been participating in the Medicare Shared Savings Program since 2012. So we've been on this journey for a little while now, and I would say one of the first areas that we looked at are clinical quality measures. Where are areas that we're doing well, and what are areas that we've been either stagnant or needing to improve, and then really putting together continuous quality improvement efforts around those initiatives. We also have been looking at reducing the overall variation in care that's being provided, evaluating awareness of and adherence to evidence-based best practice guidelines, and we found that that's led to higher quality and lower cost.
Okay, so in terms of it being sort of an interim program, you believe that this is pretty much what it will look like going forward?
So as far as MIPS is concerned, so I think, when you look at Macra and you look at the two arms of Macra, there's MIPS, which the majority of organizations are going to be kind of thrusted into, and then there are what we call advanced payment models, which are really opportunities for more advanced organizations to take on risk. I really believe that MIPS is a stepping stone to becoming an APM, an advanced payment model. It's been pretty clear that Medicare and CMS wants to move the system toward payment for outcomes and wants to have providers be more comfortable taking risk, but they also realize that that's a long-term commitment and that it takes a lot of infrastructure, personnel, technology to be able to do that, and MIPS is kind of an onboarding ramp to getting organizations those basic competencies to feel like they're comfortable becoming an APM.
What are some other key takeaways you're planning to leave with attendees
here at the conference?
Yes.
So I think really the first thing is that they need to prepare early for MIPS. So remember that 2017 is the measurement year for how your performance in MIPS is going to affect your physician fee schedule in 2019 for Medicare. So organizations should really start looking at what clinical quality measures are they going to report on and how do they think they're doing currently on those measures. They should start looking at their capabilities around advanced care informatics and whether or not they have enough of capability to be able to earn the maximum number of points there, and then also start looking at what quality improvement activities are going on to qualify for that domain as well.
Well, I'm sure your comments are very much in demand all year long. Why choose to present at the World Healthcare Congress?
Sure, so I was thrilled to be invited. This is actually my first time here, and I've been blown away by just the breadth of the conference. You really can get exposed to a lot of different areas in healthcare in a very short period of time, and I found that to be quite useful.
Thank you so much for your comments today.
Oh, you're welcome.
Appreciate
You're
it.
welcome.
And I'm Mabel Jong. Thank you for tuning in. We have much more to come. Stay with us.